and the update. Last night, there has been 81 confirmed cases from 9,930 to 10,010. 3 of them are imported cases. The rest are local cases. Of the local cases, 35 of them are currently untraceable cases. 43 are related to other cases. In the 81 cases, there are 45 female and 36 female aged between 8 to 83 years old. 24 of them were found from a temporary testing center. Of them, 9 of them were found in the Yau Ma Tei testing center and 6 in the Sham Shui Po testing center. In the 78 local cases, there are about 21 cases who reside in Yau Ma Tei area and 6 in Sham Shui Po. Of the confirmed cases, there is 1 is in relation to the Shang'an nursing home. It's someone who has been sent to a quarantine center. There is a minor hidden transmission chain in the nursing home. There is another case. Is a location in Wusong Street. Under the sewage testing surveillance program, is found that the sewage sample has been persistently positive. Previously, there was no positive result, but there is one, number 5 Wusong Street. In relation to Kensington Plaza, we have evacuated some units. Altogether, 26 people have been evacuated. We've located all persons involved. That's all for my report today. We'll now hear from Dr. Linda Yu. As at 9 a.m. in the previous 24 hours, the hospital authority has recorded 106 cases. In the previous 24 hours, another 50 patients have recovered and been discharged. So far, 8,997 of them have been discharged. Currently, 731 patients are staying in 24 public hospitals as well as the community treatment facilities. 38 of them are in a critical condition, 31 in serious condition, 662 of them in a stable condition. In relation to negative pressure beds, we have 1,224 with over 60% usage rate. In relation to the such wards, we have 676 of them with a usage rate of 75.6%. I'd like to report 2 cases to you. One is a clerk in the ophthalmology unit in Tuen Mun Hospital. She had a fever and sought treatment in the A&E department at the Tuen Mun Hospital. The last day when she went to work was the 22nd of January. She mainly worked in the back of house dealing with the clerical work of patients' records. She rarely came into contact with patients. We've finished with the disinfection of her office. We've conducted contact tracing. So far, no patients have been classified as close contacts. Out of caution, the Tuen Mun Hospital is now contacting about 30 patients who have been to that office to make appointments. We'll make arrangements for them to undergo the deep throat saliva test. We have made arrangements for about 120 staff as well as contract staff members as well as contract workers for tests. We're now investigating the source of infection. In the previous 14 days, the building she's been living in has no confirmed cases. We found that on the 18th of January, a nurse from North District Hospital has been to the 3rd floor of the eye center in Tuen Mun Hospital, but they have not been in contact. and the nurse has not entered the workplace of the clerk. Subsequently, the hospital has arranged for disinfection. And there are three staff members in the Tuen Mun Hospital Eye Center. They've undergone tests. And in Princess Margaret Hospital, a 52-year-old patient has been confirmed to have contracted the virus. The patient suffered from diarrhea and other symptoms, but no respiratory tract infection. Nasal swab has been taken from the patient, and arrangements have been made for the patient to stay in medicine ward. The patient's been notified on the 22nd of January that a previous test was positive. The test conducted at the hospital has also turned out to be positive. The hospital has started contact tracing. There is a patient in a surgical ward who stays quite closely with this patient, so that patient is now a close contact and has been sent into isolation ward. No high-risk procedure has been conducted, and all personnel have donned proper PPEs. So 13 staff members who have come into contact with this patient will be put under medical surveillance. We will also make arrangements for patients to undergo testing and disinfection. I'd like to also add information about buildings undergoing the compulsory testing. I apologize that yesterday there was a mix-up. Block 3 of the Grandiose in Cheung Kwan O, it was said that it had to undergo compulsory testing, but actually there was one case in Block 2 and one case in Block 3. So there are no more. That's not the case that there were two cases in a single block. We have delisted that building. Today, there are a number of buildings that will have to undergo compulsory testing, with some comprising 2 units in a single block. Moonstar Court in Wan Chai, there are 2 units. In one unit, 2 cases. In another, 1 case. Different floors, different unit number. The other one is Yikman Building number 9, Ha Heung Road, To Kwa Wan. 2 units. In one, there are 3 patients, and the other, 1 patient. They have the same unit number but are of different floors. The other one is Shun Fong Building in Tung On Street. 2 units with 1 patient in each unit. They are of different unit number and different floors. In Sham Shui Po, in the specified area, there are 3 buildings that have to go through compulsory testing. They are number 96 Yen Chow Street, 1 unit, 1 patient. Number 25 Yun Chow Street, 1 unit, 1 patient. 171 Cheung Sha Wan Road, 1 unit, 3 people of the same family. Of the confirmed cases today, there is 1 person who has stayed in the Baptist Hospital, aged 83, a female. On the 19th, she had a fever, and we have the result of the respiratory tract is positive. She stayed in the Baptist Hospital. At one point, she stayed in a single ward. There has been 2 tests, both negative. On the 19th, there was another test. She had a fever, and the sample was taken from the respiratory tract. Result is positive. She's sent to Queen Elizabeth Hospital. The source may be from the community, but we can't rule any possibilities. We're now working with the police, and we've arranged for all people who have taken care of her to go through tests. And in the ward, there are some close contacts and some people who have to go through testing.
We now move on to the question and answer session. Please identify your media organization before you ask your question. I'm from Now TV. Dr. Truong, well, in the specified area in Yau Chim Wang, are there any preliminary results you can share with us? And I want to know about the nearby streets and roads in the area. Do you see any outbreak? Because I know that there are also any confirmed cases from Pitt Street. How are you going to handle the situation? Kensington Plaza has seen many confirmed cases. Do you see any other outbreak or other confirmed cases from that building? Well, in the restricted area in Yau Ma Tei, we haven't received confirmation of cases. I know the labs are busy working on the tests. We do not see any new confirmed cases from Kensington Plaza today. Next, second to last row. Thank you, Hong Kong 01. I would like to ask about the male patient in Princess Margaret Hospital. So you said he had a fever yesterday and stayed in the surgical ward. He has been taking tests in the community. So why was he arranged to stay in a surgical ward? How can you allow him to stay in a surgical ward without a negative result? The North District nurse visited the eye department in Tuen Mun Hospital. How many people did she come into contact with? Could she actually be in direct contact with the confirmed cases today? I'd also like to ask about the area in Jordan. Do you think that people who have who may have a positive value may also need to undergo another test, and how many cases would there be before you would issue a stay-at-home order? Or in relation to the male patient, after arranging for tests, we arranged for him to stay in a surgical ward. The nurse who visited the eye center only visited consultation areas and was not in contact with the preliminary confirmed colleague. And the 3 persons whom she came into contact with had negative results. But we are going to continue with our contact tracing. The speaker is off mic. She lives in Chengyi, so not in those quarantine areas. Well, it's very difficult for me to give information on what we need to do. We will, of course, take into consideration experts' advice. How about an English question?
THK, so do you have the total figure of the number of cases for the entire Yau Chim Wang district? And also among the 21 cases found in Yau Ma Tei, how many actually came from the restricted area, which is under lockdown at the moment? And do you have a figure of the number of preliminary positive cases so far? And also there have been some reports about residents getting false negative results from community testing centers. Do you think that just testing once for the residents in the restricted area will be sufficient to find out all the positive cases? And do you think there's a need to conduct a second round of testing for those residents? And also, do you think there's a need to expand the lockdown area because there are also other cases found in Sham Shui Po and other parts of Jordan and Yau Ma Tei? Thank you.
There are more than 70 preliminary positive at the moment. For the 78 local acquired case today, we have 21 from the Yau Chin Wang district, the whole district, and 6 of them are from the compulsory testing area. Yeah. And I think it's important that people, even they had undergo testing because of the incubation period and various factors, date of collection and the site of collection. So the general public should observe if they have any mild symptoms, they should go to seek medical advice as soon as possible for testing. So not only rely on the type once or twice testing. Yeah.
我哋答多條英文問題，前面呢位男。
How about another English question? The gentleman in the front.
The South China Morning Post. Should we expect the daily case numbers might rise? We're already at a high number, but do you expect that they might rise further given we have this restricted testing area now? With the 80 cases today, what does the makeup of the cases indicate as we break through 10,000 cases overall, and particularly on the anniversary of the first confirmed COVID case 1 year on? And on the UAE, I want to revisit an answer you gave yesterday, Dr. Chuang, because you hinted that the UAE met the threshold to be considered being put on the high-risk list of countries, which would require a pre-flight test for passengers. Denmark today has suspended flights from the UAE because the health authorities think that the tests obtained pre-flight are not reliable. Separately, Emirates have resumed Hong Kong flights today, and in the next hour, their first flight from Dubai will land at Hong Kong. Do you think the health authorities should move quickly to decide whether they should implement pre-flight testing vis-a-vis high-risk classification or ban flights outright?
We are expecting the daily number of cases is getting at least more and more in this coming few days because of the enhanced testing in the restricted area, and also there are still quite significant transmission in the community. And for the UAE, it has exceeded the threshold for asking them to provide the test result, negative test result, as well as a 21 hotel booking. I understand it's being considered by the Food and Health Bureau. Yeah, but currently all passengers from all overseas places, they have to stay in the designated hotel. So for quarantine, I think it's already a strict measure.
下一位嗰邊後邊最後咯。
Next, a lady in grey in the back row. I'm from Apple Daily. I would like to ask about Shang'an Elderly Home. How is the situation? How many staff members have been sent to quarantine, and how many confirmed cases are there? Well, there is a mini silent transmission outbreak there. Do you know the traces of that in relation to the 83-year-old female patient in Baptist Hospital? Which case number is she, and how is her situation right now? There are about 20 elderly and about 6 staff members from Shang'an Elderly Home sent to quarantine. One of them is not feeling well right now and is confirmed positive after being sent to hospital. And this person may be related to previous cases. This patient is bedridden, and there may be reasons that the patient got transmitted by visitors or staff. But right now we do not see any other confirmed cases, so we'll have to observe this further.
The Baptist Hospital case, I haven't cross-checked with Dr. Yu, so I don't know about the actual situation. I know the patient has been sent to Queen Elizabeth Hospital. The number 9953. The one in white. I'm from Oriental Daily. I'd like to ask about the cases today. How many cases are there in Shamshui-Po and Yau Chim Wang that are of South Asian ethnicity? What about the case in Tuen Mun Eye Center? Can you rule the possibility that she's infected at the hospital or in the community? There has been previous cases where staff members have been spreading the virus in their pantry in the Tuen Mun Eye Center. In relation to the Baptist Hospital case, well, between 17th and 19th, to which ward has she been sent? How many patients and staff members are classified as close contacts and have to be sent to a quarantine center? I have not counted the number of cases that are non-Chinese, but there are some cases, but not the majority. Most of the cases are of Chinese ethnicity. The Baptist Hospital case. I don't think there are any healthcare staff workers that are classified as close contact. There may be patients staying in the same cubicle that have to be isolated. There are a few of them, but I haven't counted. The preliminary positive case, the clerk in Tuen Mun Eye Center. She has not come into direct contact with confirmed cases or the North District Hospital nurse. But is there an indirect connection? Well, there are 3 staff members who have been in contact with the nurse. They have been tested. We'll arrange for retesting to find out if they are confirmed cases. In the community, there are a lot of untraceable cases. Investigation is ongoing to find out. The lady in black in the middle. I'm from Meng Pao. You mentioned about Sheung On Nursing Home. Are there 2 residents who have been confirmed? And what is the case number of the confirmed case in the nursing home today? 21 cases in Yau Chim Wang. You're talking about the specified area, that is the bigger circle? Which area is it? Yesterday, Dr. Chang talked about Pitt Street. There are a lot of subdivided units and you would go there for another round. Have you identified more cases, more people who have to be sent to quarantine centers, or more people who have to undergo compulsory tests? Have you identified any high-risk factors causing the higher number in cases? What is the situation like in terms of the environment or facilities? The Jordan area that is now restricted, a lot of people have already left the area. What is your assessment of the risk of the virus spreading to other areas? The government said there are lots of buildings with no owners corporations and management companies there. If they are locked in for 48 hours, wouldn't it increase the chance of cross-infection? It's just reached the anniversary of the first case, and number of cases has hit that 10,000. Is it the case that it has gone beyond your expectation of how it has developed? Are there any areas you think that can be further improved? The number of the Sheung On Nursing Home is 9951. I was referring to the Yau Chim Wang district. not the specified area when I said 21 cases. In Sham Shui Po district, there are 6 cases. 5 of them are within the specified area. For the Yau Chim Wang district, well, when I said specified area, I refer to the area in which when there is 1 case, the residents of the whole building will have to undergo compulsory testing. Yau Chim Wang specified area, that is the bigger area, there are 6 cases today, of which 3 are from the core area, but I have not broken it down to the restricted area because of the low number. Yesterday, we've asked our colleagues to see if we have missed any subdivided units. The situation is a bit complicated because people are not clear about the address they live in. We were looking for 5 units. We've knocked on the doors of 4, but no one was in. In the last one person was sent to the quarantine center. The environment is not the purpose of our visits. Since they are subdivided units, we expect the living environment to be rather cramped. People living in Jordan don't restrict themselves in Jordan. They will go to other areas to work or to go about with their daily activities. That is their daily lives. So it's not just the case that they've left last night and they have brought the virus with them. Hong Kong is small. A lot of people will conduct their daily activities across different districts, just like a lot of Hong Kong people. Of course, there is always a risk of the virus spreading to a different area. But it's not the case that there is no case in other areas. Whether there is a lockdown or not, this problem will still be in place. We've had a tough year. It's not just about Hong Kong. It applies to the rest of the world as well. We have seen a lot of unprecedented measures being put in place, and we've seen situations that were once unimaginable. We've never imagined that there will be closure of borders and banning of flights. People have worked very hard to fight the epidemic, and it is applaudable that Hong Kong people have been very self-disciplined and have been very good with their masks. Sorry, speakers off mic. They live there. They've been living there. We just asked them to undergo a test within 2 days. It's not the case that they will be restricted from leaving forever. With or without the restrictions, they live there. Any other questions? If not, that's the end of the press briefing. Thank you.